Hey, what's good YouTube fam? How you guys doing? Hope you guys are having a great day, because I have been feeling pretty tired as of late. As a matter of fact, probably gonna go take a nap. Yeah, I'm gonna have to come back.
48 hours later.
No, five more minutes. Yeah, get away. All right.
Anyways, I hope all of you guys are having an awesome day, and I really hope you guys can stay awake and stay focused while listening, because today I'm going to be talking to you about 5 reasons that you may not even know are the cause of your fatigue, aka fatigue. So based on my interaction with hundreds of people, patients alike, I've realized there's this kind of disconnect between the medical literature and the basic everyday person's understanding of medicine, and enter me. I am at your service, and I am going to try to help align all that for you. Basically, I want my videos to be intended for the average person sitting at home who wants to learn a little more, and this got me thinking about starting a series where I address and talk about common medical issues that you may not even be completely aware of. And as they say, knowledge equals power. So fasten your seatbelts, because today we're gonna be talking about fatigue. So there are about 1.5 million reasons you could be tired. I'm just gonna talk about 5 common reasons. So chances are, if you're watching this video, there's a high probability that you or someone you know has been suffering from fatigue for a long time. So without any further ado, let's get into it. Number 1. Ladies and gentlemen, I'm talking OSA, that is obstructive sleep apnea. It's the most common sleep-related breathing disorder, and it is characterized by recurrent episodes of complete or partial upper airway obstruction. I mean, think about that. You're just sleeping casually and you just stop breathing. I mean, most individuals with OSA are completely unaware of the disturbances that they have in their breathing while they're sleeping. Sometimes if you have a bed partner or family member, they might observe some of these periods of gasping or choking that they see in the individual who's actually sleeping. But people who are often sleeping alone, they're completely unaware of this condition. Symptoms may be present for years or even decades without identification, during which time the person just becomes kind of conditioned to this daytime sleepiness and this everlasting fatigue. I mean, some of the things that you see in these people, oftentimes risk factors, are they're older males, they're obese, they have sometimes craniofacial abnormalities, and sometimes even smoking. Classically, the textbook is going to describe these people as like super obese, they have high blood pressure, but not everyone's going to fit into this criteria. Anyone want to guess who else was found to have sleep apnea? Yup. Yours truly. I'll tell you guys my story. So I actually noticed that I would feel extremely tired in the mornings, and no matter how much sleep I was getting, I would still be tired, man. It was so frustrating. I found that my main symptom was actually that I always had to get up in the middle of the night to go and pee. It was like 3 times a night, 4 times a night, 5 times a night. I was getting up to go pee, and it essentially led to me having to struggle to fall back asleep and get enough actual REM sleep. So I went to the doc, got my labs drawn, and after everything, it was all normal. And I was pretty confused, because at that point, I knew something was off and something was not right. Anyway, eventually, I thought about the idea of getting a sleep study, and lo and behold, I was found to have moderate sleep apnea. Now, the typical treatment is just CPAP, or it's like a mask that you use, but I actually use these nasal plugs, which basically help to increase the pressure whenever I breathe out at night. And that's supposed to keep the airways open, but they're not the most comfortable things, and sometimes I even pull them out when I'm in the middle of my sleep. So I'm actually going to try and see an ENT surgeon and see if having that type of evaluation could potentially be helpful. Maybe a tonsillectomy, adenoidectomy, or sometimes even they can do surgery on the uvula itself. All of those things can actually increase the airway size, and sometimes those things can help. So I'll keep you guys updated, and if you don't feel like your sleep is all that great, you snore, you don't like the feeling that you're getting when you're resting, well, it may be time to get a sleep study. Number 2, thyroid issues. So hypothyroidism, it's a disorder of the endocrine system where your thyroid gland essentially doesn't make enough thyroid hormone. And it can cause a number of symptoms such as always feeling cold, feeling tired, constipated, slow heart rate, dry skin, weight gain. It's like imagine everything in your body kind of just slows down. And that's contrary to hyperthyroid, where everything generally speeds up. Now, worldwide, the most common cause of this is too little iodine in the diet. Now, Hashimoto's thyroiditis, or an autoimmune condition, is actually the most common cause of hypothyroid in countries that have sufficient dietary iodine use. So actually in the US, that's the most common cause. Now, the cool thing with hypothyroid is that usually the fix is pretty straightforward. You suspect the diagnosis just based on a lot of these symptoms, and you can get some blood tests that measure your thyroid function. And most people with hypothyroid symptoms and confirmed thyroxine deficiency are treated with just this synthetic long-acting form of thyroxine known as levothyroxine. And after that, you pretty much just get your blood work done and check your TSH and your thyroid levels, make sure that the dosing is adequate. So number 3, guys, it's a big one, it's anemia. So what is anemia? It's basically you have a decrease in the total amount of the red blood cells or the hemoglobin in the blood. And that leads to a lower ability of the blood to carry oxygen to your body, and that causes you to feel tired.
And a man who lived after death, lived on human blood, took the form of a vampire bat.
It's a super common blood disorder, and it affects about 1/3 of the global population. Now, iron deficiency anemia in and of itself is like a subcategory, and that affects nearly 1 billion people worldwide. Most cases of anemia can be diagnosed by employing the morphologic approach, in which the anemia is kind of just classified by the red blood cell size, which is the MCV, or the mean corpuscular volume. There's so many classifications for anemia, and we're not going to get into all that in this video, but typically one of the common things that you're going to see in people who have anemia is that they tend to look very pale, and that's usually when the anemia is a lot more severe and their heart rate is fast too. These are some common signs that you'll see. Now, anemia can be caused by a lot of things, so it's really important to go get it evaluated by your doctor. Anemia in general can be caused by blood loss or decreased red blood cell production, or maybe it's something causing increased red blood cell breakdown. So some of the things could just be trauma, you're having bleeding. At the hospital, we see a lot of like GI bleeding or internal bleeding. That can cause anemia. Sometimes having iron deficiency or like B12 deficiency, vitamin B12 deficiency, bone marrow is not producing enough, or even like autoimmune diseases can cause you to have a form of anemia. So you really want to identify the reason for it and then kind of treat that cause. Number 4, meds and drugs. You guys want to know what else can make you tired, and it's so common. It's meds. It's so many different ones. There's a chance that substance use of any form or medications, different med toxicities, or having too much is what's actually making you tired. So like benzodiazepines, antihistamine drugs that are like Benadryl, alcohol, antidepressants sometimes, and sometimes these anti-anxiety medications, muscle relaxant like your Flexeril, like your narcotics, your opioids. Guys, if you suffer from chronic pain and you're taking a bunch of these medications, I can almost guarantee that that's one of the reasons you're actually feeling tired and fatigue. Now, that's a whole other issue for a different discussion, but increasing opioid use in the US has been ever so prevalent, and it's an increasing problem resulting in so many more deaths from overdoses in the last few years. But even narcotics and oral pain medication use has also increased, and it brings me to such an important point in this video in general, and that's that you guys should always know the reason that you're taking whatever medication that you're on. Always ask your doctor, why am I taking this medication? What is it for? And how long do I need to potentially be on it? And that's really important for you to kind of have that discussion so that you know exactly what's going into your body. All right, number 5, guys, depression. So this is something not to underestimate. It's super common, and I mean, a lot of people actually have such a severe form of this that it affects and it impacts them in such a huge way in their life. Depression, I mean, it changes your sleep, your interests, your feelings of general guilt, your energy, concentration, appetite, everything. It can be affected by depression. And this is the one that I don't want you guys to really underestimate. Guys, mental health stigma is still present in society, and we often don't address this issue until it's too late. Depression is the leading cause of disability worldwide. And this is from a United Nations Health Agency report estimating that it affects over 300 million people worldwide. Estimated that 4.4% of the global population suffers from some form of depression. So again, seek help. It is much wiser to receive appropriate treatment for disabling conditions like this. CBT is a form of therapy that helps so many people. And I actually highly encourage you to consider that if that's something that you're struggling with. So anyways, guys, I hope that you enjoyed the video. I know there are so many other things, and this video wasn't intended to be like an in-depth look into a specific condition, but rather I was just trying to make it a brief overview and something to encourage you guys to really see your own healthcare provider, because ultimately health is wealth. So I hope you enjoyed this video and I hope you learned something. I'll catch you guys in the next video. Keep being a boss.